Hi everyone, so this is my 6-week update after my surgery. It's been exactly 6 weeks since the surgery of, again, you should all know by now, repairing the Tfcc cartilage in my wrist and also doing the ulnar shortening to keep it from tearing again and aggravating it again. Um, 6 weeks is a big milestone for me because mainly the main one is that I got my cast off. Um, and saw the doctor, obviously. But before I go into the doctor's visit too much, I wanted to do a little recap of the last 3 weeks. My last update was at the 3-week mark, and a few things happened in between there and now that I was going to go over. So the main one is that I really didn't talk about this in the other videos much, but I had been having a lot of elbow pain right at the tip of my elbow literally since the surgery. Didn't really think much of it because my whole arm was swollen, and for the first 2 weeks my whole arm was in pain. So I kind of disregarded it. And when they put on the first fiberglass cast at the 2-week mark, they left the elbow open, and I assumed it was going to get better, maybe because the original splint was pushing on it or something, I don't know. But try to be optimistic. So, but it didn't get any better. It actually kind of got a little bit worse. And the best way to describe it is just right here at the tip of my elbow. Just really, really painful if I set it down on anything. And if it accidentally bumped a wall or anything, it was excruciating. Just sitting there by itself, it's fine. But laying it on anything was really painful. And it's just really annoying because with the incision under my arm coupled with the pain in my elbow, I could just never set this arm down on anything, whether it was in a splint or a cast or a sling. It didn't matter. I could never set this arm down on anything and ever be comfortable. So finally, at just over the 3-week mark, I decided to make an appointment with the doctor and ask him about it. He decided to take the cast off and do another x-ray and kind of just go over the whole thing just to be sure. And he did notice there was quite a bit of swelling in the elbow, and it was extremely tender. But he said it was basically just I forget the term that he used. It was a form of bursitis, elbow bursitis. And he said it was probably mainly caused because after the surgery you have a lot of swelling, which is a lot of fluid and blood in the arm. And since I had it vertical all the time to keep the swelling down, it would all pool in the elbow, and it just basically kind of got stuck there, I guess you could say. But he also basically implied that I was overdoing it based on a few factors. He felt that I was overdoing it, and he felt that the only way to protect the elbow, usually they would put like a gel pad on it, because of the way the Munster cast was, they really couldn't. That coupled with the fact that I was overdoing it, he said, your recovery is going to be prolonged if you don't take it more easy and you protect the elbow. So, in the Munster cast, it might end up being a week or two longer than anticipated, or we can put you in a long arm cast that will protect the elbow and keep you from overdoing it, and you'll get back on track and have your cast off and be done with it at the 6-week mark. So he kind of suckered me into that, and I had no choice. So the last almost 3 weeks, just under 3 weeks, I had a long arm cast, a cast way up here. And honestly, I didn't mind it so much because my wrist was actually less painful in that, because I couldn't overdo it. It kept me from hurting myself and overdoing it. So I don't know, maybe he should have done that in the first place, who knows. The long arm cast is not fun. It's definitely hotter, definitely sweats more, it definitely limits you more, but that's what you need in this kind of surgery. You need to be limited, especially somebody like me. Those who know me know that I'm always doing stuff. I'm always, always busy doing this and doing that, and so maybe I'm the kind of person that needed that in the first place. Anyways, I also wanted to bring up that if you remember in my last video, I talked about getting one of these little therapy balls to exercise my fingers. and it's worked really well at the 6-week mark right now. I have a lot of grip. I'd probably say I'm about 80, almost 90% back to normal as compared to this side, I think. Haven't fully tested it, but then also a couple weeks ago, I also got these little bands. They make them in different resistance, and they're to stretch out your fingers, because I noticed that my fingers, I mean, immediately after the surgery, they didn't go out at all. So I was exercising them, and basically decided to get the band. And you know, the band, you can do it in a few different ways. The main one is to do it like this, stretch it out. When I first started doing this, I couldn't stretch it out at all. Literally just kind of didn't move at all. Now I'm doing pretty good. I can get it pretty far out. But the one thing I noticed is that the pinky, for some reason, is completely still, just has almost no strength flexing out at all. And I wasn't sure about that, so I asked the doctor on this visit about that. And basically, there's two factors. One of them is that the second incision on the top of the wrist is very near the tendon for the back of the pinky, near your wrist. And then also he put the ulna plate on the top, sort of on the top of the ulna, which also is running directly under the tendon and muscles for the pinky. So that explains a lot. I'm sure it'll come along, and he's not worried about it, so I'm sure it'll be fine. Anyways, as far as the visit today with the doctor, it literally was about, let's see, it's 4:45 right now. The appointment was at 2 o'clock, so it was only about 3 hours ago. Went pretty well. They took off the cast, decided to get another x-ray. Wasn't too painful this time. So the doctor, you know, he did the examination, said everything looked good, moved it around a little bit, said everything was good to go, on track. We went over the x-rays. I still haven't gotten a copy of the before surgery x-ray, but we did look at them side by side, the before surgery and the after surgery x-ray, and I hadn't seen that for about 2 months, the original x-ray, and I had forgotten how bad it was, and it was a huge difference. You could see just how much longer the ulna was. It was just shoving up into my wrist bones, and in fact, when I saw that and I was thinking about after the surgery, he told me he'd shortened it 4 millimeters. Honestly, it looked like it was 10 millimeters that he shortened it, just based on the x-rays. I'm sure it wasn't, but it was a huge difference. So anyways, he gave me a brace as opposed to a splint. This is just like a neoprene Velcro brace. And he said to wear it for the next month. For the first 2 weeks, pretty much almost all the time, unless I'm just sitting doing nothing, and then for the remainder of those 2 weeks to wean myself off of it completely. I have a referral for physical therapy for at least 6 weeks, and then we'll see after that. My next appointment with my doctor is in 6 weeks. So that's pretty much the visit at the doctor's. I think it feels pretty good. I mean, considering I haven't, you know, it's only been a couple hours, but it feels pretty good. Definitely a strange feeling. It feels completely different. Flexing my fingers out of the cast as opposed to when it was in the cast. Completely different feeling. I think because you have to now stabilize the wrist while you're moving your fingers. You know, I haven't really had a chance to try it much. I've moved a little bit. It seems to move up pretty good, and it's not too painful. It's just stiff. Side to side, not much. A little bit, really stiff, and same thing down. Down is just not happening at all. I'm not sure why, but it doesn't want to go down whatsoever. It's pretty much locked there. You can probably see the incision. It is about 5 inches long, and that's for the ulna plate. And then you can see the two wounds for the incisions for the arthroscopic procedure. A lot of skin's been coming off my hand and arm, after 6 weeks in various casts. I must have washed my arm about 4 times in the last hour, and skin just keeps coming off more and more and more. There was a big, long, sort of thin scab on this guy, and after the first time I washed it, it just sloughed off. I didn't pick it or pull it or anything, it just sloughed right off. Feels pretty good. It's pretty sensitive in this area. I can't say that I don't think that I feel the plate. He told me it was up on the top here. It's very hard, and it seems higher up. The hardness seems to be higher up than my other arm, so maybe I'm actually feeling the plate there and I just don't realize it. I don't know. Who knows? Not really too concerned about feeling it. Hope I don't feel it. As far as pronation, supination, they call it when you twist it, I can do that. It's really stiff. So not too bad. The only thing that was kind of really caught me off guard was that I left the doctor's office, was driving home on the freeway, and after about 15-20 minutes on the freeway, the best way I can describe it is it felt like a muscle spasm or muscle cramp. If you've ever had a really bad muscle cramp, that's exactly what it felt like, but in an area with a lot of surgical work that had been done, it was excruciating. I could feel it coming on for a few seconds, and then it just felt like something in there just spasmed and just locked, like a complete muscle cramp, right in my wrist. Basically, like right in this area. I could feel it kind of travel up there, and it did this on and off about 6 or 7 times for about 20 seconds apiece, and it was really, really painful. It was excruciating. I literally was almost in tears. Almost had to pull over to the side of the road because I didn't think I can drive. And I think what it was basically my arm being out of the cast for 6 weeks. The muscles were just sort of reconvening themselves, and they just spasmed and cramped a little bit. It's been fine. Hasn't done anything. That was a couple hours, 2 hours ago roughly, and it's been fine. As you can see, I have it out of the splint right now. I probably should be wearing the splint right now, but I'm just so glad to be out of those casts that I'm going to give myself a little break. I'm just not going to use it for anything. That's pretty much the 6-week update. I hope I remembered everything. I probably will do another update after my first round of physical therapy just to see how that goes. And then I'll do some updates, I don't know, sometime in between those physical therapy updates, or maybe in the next 6 weeks after that. We'll see. I don't want to make this video too long so I won't drag on. But anyways, very excited, ecstatic. If anyone who's ever had a cast on their arm for 6 weeks, it's not fun, and I'm in a very good mood to have it off and to be able to feel like my arm is free again. So that's pretty much it for now. Thank you. Oh, and I also want to take this opportunity to thank all my friends and family who've helped me so much in the last 6 weeks. I haven't said that in my previous visits, but I do appreciate it, guys, all your help, and thank you very much. All right. Thank you all. Bye.